Most people either hit a wall around 3 or 4 months after ACL surgery, or they think things are going great, when in reality, their program isn't building the strength and control they'll need for a full recovery. They're going to physical therapy, putting in effort, doing what they're told. But whether they know it or not, progress starts to stall. If you're in this stage or this sounds even a little bit familiar, this video is for you. In this video, I'm breaking down exactly what the middle stage of ACL recovery should look like, what goals you need to hit, what tests actually matter, and how to know if your knee is truly ready to move forwards. If you're new here, my name is John Call, and I'm a physical therapist specializing in ACL recovery. Through my online coaching platform, ACLRX, I've helped hundreds of people fully recover after ACL injury and surgery. By the end of this video, you'll know the clear criteria that separate people who crush their recovery from those who plateau and increase their re-injury risk. Let's dive in. Generally speaking, mid-stage ACL rehab will typically start around the end of month 2, spanning into months 4 to 5 after surgery. But here's the thing, time since surgery means nothing if your knee isn't actually ready. So I always suggest using a criteria-based progression to guide decision-making. Let objective testing be your guide. If you haven't achieved all or most of the criteria in the early stage, you could be setting yourself up for frustration and a longer recovery. Successful completion of early stage rehab should include establishing a quiet knee. This means we have minimal swelling, pain levels are under control and rated a 0 to a 2 out of 10 with daily activities, full knee extension range of motion that is symmetrical to your non-surgical knee, and having at least 120 or 80% of full knee flexion range of motion, good quality quadriceps activation and control, and be able to walk with normal mechanics without crutches. For a full breakdown on each of these components so you can set yourself up for success, check out the video card in the top right corner, and I'll also drop the link for that video in the description. Now, these phases aren't completely distinct entities. Rather, think of them as a progression continuum. However, the priority should always be to accomplish the goals from the previous phase before getting too deep into the weeds of the next phase. Once you've established a quiet knee and laid a strong foundation, the focus now shifts to building true strength, movement capacity and control, and confidence. Think of the mid-stage as the bridge between rehab and athletic movements. There are 4 main goals we should aim to achieve in this phase. Build sufficient leg muscle strength, especially in the quadriceps and the hamstrings. Develop quality neuromuscular control of foundational movement patterns. Begin to reestablish cardiovascular fitness, and safely initiate jogging. Let's break down each one. But before we do, subscribe, share, and hit that like button if you're finding this useful. Arguably, the most important part of this phase is regaining sufficient muscle strength. This lays the foundation for joint health, long-term function, and everything else to come down the road. First and foremost, the quadriceps and the hamstrings take the biggest hit by far after this injury and surgery, so they need to be prioritized, especially the quadriceps. Regaining sufficient quadriceps muscle strength is arguably the top metric to restore, as it will have a direct impact on re-injury risk, long-term joint health, rate of osteoarthritis development, and quality of life. In order to best improve quad and hamstring muscle strength, it's recommended to include both closed kinetic chain exercises like squats and leg presses, and isolated open kinetic chain exercises such as knee extensions and hamstring curls. Yes, you heard me right. The knee extension machine is a staple in a successful ACL recovery. If you want to learn the research-backed answer about this exercise, check out the video card in the top corner of this video, and I'll also drop that link in the description. Without isolated quadriceps strengthening from the knee extension machine, your body will compensate, even when exercise form looks good, and it will leave your quads weak. And here's a pro tip. Don't forget to keep training your non-surgical leg hard throughout this entire process. Now, while the knee muscles are critical, we can't get tunnel vision. The ankle, hip, and core muscles matter more than you might think. So it's incredibly important that your program includes proper strength training for these muscle groups and these joints as well. The specifics of strength training exercise prescription will depend on a case-by-case basis. The sets, the reps, the weights, the exercises, all depend on where someone is currently at and what they can safely tolerate. A good rule of thumb for this phase is to start with weights that are challenging in the 12 to 20 rep range, and then gradually progressing the weights so the reps start to naturally drop to 6 to 12 reps. I break this concept down in detail in my PR mindset video. I'll link it above and in the description. But strength isn't everything. Now we need to make sure that we can express that strength with quality control. Your body is a master compensator, and it will find ways to take stress off of your surgical knee after ACL surgery. From muscle weakness to altered sensory input at the knee joint, we need to restore capacity, control, and confidence with movements like squatting, split stance work, and hip hinging. Sounds simple, but this is where you start retraining how you actually move. Not favoring one side, not shifting your weight, and not compensating. This is where an ACL specialist is critical. Having a trained eye to know exactly what to look for and how to modify it is critical, because if we don't address these compensations now, they will persist and show up later when you try to run, jump, and get back to higher level activities. I personally use detailed video analysis with all my online clients to educate them on what's happening, why it's happening, and how to correct it. So the goal here is simple. Move well first, then build capacity by loading those patterns with a weight, and then progress the exercise. Not only do your muscles take a hit after ACL surgery, but so does your cardiovascular fitness. Mid-stage rehab is a great time to introduce low-impact cardio to rebuild that fitness base. This can include pool exercises and cycling, done 1 to 2 times per week. Now, while this shouldn't be the priority, it definitely deserves some of your time and effort. You could have all your strength and power back, but it won't mean much if your gas tank is constantly empty. In addition to cardiovascular fitness, make sure you train your upper body too. Don't let your upper half go to waste just because your knee is recovering. Let me be clear, running doesn't start just because it's been 12 weeks in surgery. It starts when your knee is ready for it. This is a data-driven process, not a date on a calendar. Too many people are told to jog without any prior prep work or testing, and they end up with an irritated knee. The magic is in the prep work. So what criteria do we need? We need full knee extension range of motion. We need minimal to no swelling. And we need at least 70% quadricep strength compared to your other leg, and a peak knee extension torque of 2.0 Newton meters per kilogram, and also successful completion of a pre-jogging program and plyometric programming. Think about it. Jogging is a series of mini jumps. So you need an appropriate jumping program to build your knee up to handle those forces. Once you nail down those numbers, it's time to follow a structured walk-jog program that gradually builds distance. Because just go slow and ease into it is vague, lazy advice that often results in flare-ups. So what specific criteria are we aiming for by the end of this phase? First and foremost, you need minimal to no swelling, full knee range of motion that is symmetrical to your opposite knee, and a proper foundation of strength. Towards the middle to end of this stage, you should be completing your first proper strength test to see how your surgical leg stacks up to your non-surgical leg. Because progress isn't about guessing, it's about data. Here are the evidence-based recommendations by authors Buck Thorpe and De La Via on what you should aim to achieve by the end of mid-stage ACL rehab. So to crush the mid-stage of ACL recovery, remember this: you must earn the right to progress. You've laid the foundation in the early stage. Now you're building strength, control, movement quality, and confidence that will carry you into running, sports, and an active lifestyle safely. Don't skip steps, don't chase time, chase milestones. If you found this video helpful, hit that like button, comment what was most helpful, and subscribe. It really helps this information reach more people who need it. And if you're feeling stuck in your recovery, whether you're pre-surgery, 5 years down the line, or anything in between, and you want expert help getting back on track, click the link in the description to book a free call with me. We'll figure out exactly what's holding you back, and I'll show you how to build a recovery plan that actually gets you back to the activities that you love.